Smoker's lines, perioral rhytids, we don't like them. How do you get rid of them? People have tried all kinds of things. People have tried injecting fillers, they've tried topical creams and lotions and topical peels. In my hands, I find that this is a challenging treatment area. And so I've come up with the LaMiNa treatment, which is lasers, microneedling, nanofat. It is a technique that I published about 3 or 4 years ago, so you can look it up online and see it. But here it is in person. This is CO2 lasering, and you can see that we're sucking out the smoke, because really what the CO2 lasering is doing is it is completely vaporizing that top layer of skin. Anything that has water in it, this laser will destroy and make go away. So we do 2 passes. The first pass, very, very deep laser penetration, but not too close together, so it allows it to regrow very quickly. And then the second pass is very superficial, about 5 to 10 microns, but almost near confluence. You do these 2 in combination, it really helps tighten that skin. If you were to do this on its own, it's very, very painful, and patients stay red for weeks, for a really long time. So what I've pioneered is this technique where we harvest patient's fat and we pull it up into these little 10 cc syringes. So we're taking the patient's own fat and we emulsify it in a process called creating nanofat. It gets pushed back and forth multiple times, and that shear force literally rips all the cells apart. So there are no fat cells that are left alive in here except the stem cells. But it has all of the extracellular matrix proteins that are all mushed in there, all the cytokines, everything is there. They're like exosomes on steroids. And then we pass this through a tiny little filter it down to 500 microns in size. And then we microneedle the patient's face. This is going down 2.5 millimeters deep. So it's going through the epidermis, through the dermis, down to the reticular dermis. And then we apply the nanofat right on top of that. It just is absorbed like a wave crashing on a beach and the water sinks into the sand. That's exactly what's going on here. And the nanofat just is absorbed right down to the reticular dermis. The reticular dermis is the workhorse of the skin. That's the engine room where everything goes on to drive the healing process. So this patient will heal up very, very quickly from this process with almost no pain whatsoever. She'll be back out doing regular activities as soon as about a week, 5 days after the procedure. And this is the most effective way of treating these fine lines and wrinkles around the lips. LaMiNa, lasers, microneedling, nanofat. I hope you like this. Thanks so much to Jolene, who wrote a great piece about this, about the future of fat and fat grafting to the face. We'll have another session about actually injecting the fat into the face, but this is top-down benefit. Thanks so much.